tonight we're going to talk about bowel and bladder control primarily. So Dr. Graves and I both actually trained together at the University of Pennsylvania in Philadelphia, and we've been each practicing for close to 10 years, and we've had 5 years of urology training in residency and med school before that. And the topic tonight is something that we do have a lot of focus in and enjoy taking care of and have specialty in. All right, so there's three kind of categories to kind of simplify this about bladder control issues. One is stress incontinence, and I'll describe that more in the next slides. The second is urinary retention, which is the inability to actually get urine out, where the urine is trapped in the bladder and you can't fully empty the bladder. And the third is overactive bladder. So stress incontinence is the kind of incontinence that some patients can have, in which when you increase the pressure on the bladder, it overcomes the ability of the sphincter to control the urine. So sneezing, coughing, laughing, standing up real quick after you've been sitting for a while, climbing up things like stairs, exercising, and then you get a dribble or even sometimes a full emptying of the bladder as you do those activities. So that's deemed stress incontinence. And that is an issue typically with the sphincter itself and the pelvic floor, with the inability to control the bladder from emptying. And that's an issue that some women have with age or after childbirth that can occur. In regards to men, that would be something that sometimes we see after prostate type procedures. And then also, something with age that can occur. In regards to urinary retention, that's when you can't fully empty your bladder. Sometimes patients will show up to the emergency room or our office with the inability to empty their bladder, and they need a catheter put in to drain the bladder. Other times it could be a slow chronic situation where they don't empty the bladder fully and it builds up into an inability to empty. That's actually dangerous because you're not able to clear all the toxins out of your body and you can get infections or kidney failure. But this is something that's important to tease out. Usually in these cases, you can have leaking, but the main symptom is difficulty emptying and a weak stream. And then overactive bladder is a quite common situation in which you have a bladder that isn't able to hold urine for the amount of time it should in between urination. So you get frequent trips to the bathroom, strong urges to pee, even though you just urinated, went to the bathroom and peed. 20 minutes, 30 minutes later, you feel like you got to go again and are heading back to the bathroom. And that can sometimes progress into urge incontinence, which is a type of leaking of urine, as opposed to the stress incontinence where you sneeze, cough, strain, and leak. This is where you get a strong urge to pee and you can't hold it back, and then you end up having a leak before you can make it to the bathroom in time. And then a different kind of incontinence would be this fecal incontinence, which is basically bowel incontinence. And this is not urinary incontinence, but a situation in which you have control issues with having bowel movements. So you can actually have loss of control where you have accidents with your stool. Sometimes that could be a strong urge that you cannot control, or other times it's a loss of feeling that you have to go, and you can have either small accidents or a full incontinent episode with fecal incontinence.